Heard of teeth in a day? Curious about our dental implants? We brought our patients here to talk about their experience. This is The Round Table by Yorkshire Dental Suite. So guys, if you just all want to quickly introduce yourselves.
Well, I'm Bob Foster. I'm from Halifax in West Yorkshire.
And I'm Carol from Leeds.
I'm Jafar Musa from Skipton, North Yorkshire.
Very nice. I'm Tracy and I'm from Leeds. Yeah, I've been living in Leeds 30 years or more.
How has life been since you've had your dental implants fitted?
I feel more confident in a way. I'm not aware of the gaps in my teeth. More importantly, my wife is not aware of the gaps in my teeth, which comes as a great source of joy to me.
That's great, that's great.
Can I say something? To me, it's actually a complete transformation. And because I usually visit the hygienist every 2 months, which costs money and painful, and that is out of the question now.
So I've had to have my implants because I had abscesses and I lost a lot of bridges. And of course, when they came out, I had big gaps at the back and I couldn't really eat either because I didn't have any bite. So it's helped with that, yeah.
It's amazing how you remember the day when you suddenly decide. So I had a lot of teeth out in my 30s and 40s, mainly around the back. And I remember I was sat with a friend eating some roast beef and I thought, I'm fed up of having to move things about. And it was that decision that day where her husband worked for the practice and it was like, I can recommend somebody, and it just changed my life from, I didn't think it was about vanity, it was more to eat, but now having a better smile and
as a bonus.
not having to move the food about. So it's mainly eating, and what a difference now.
What dentists did you all see when you came to Yorkshire Dental Suite?
So I was Dr. Dalgoose for the main work, and I haven't gone back to the NHS since then. That was 2020. We were saying that earlier about sticking with people I now trust.
I've been to other surgery, I got to admit that, somewhere in West Yorkshire, and I wasn't happy. I didn't feel confident, didn't feel comfortable. When I saw Dr. Dalgoose, just completely different feeling.
Well, it is. You've got to have confidence in your dentist.
Absolutely.
How did seeing your new smile the first time make you feel?
Well, it's a big smile.
Isn't it just?
Not like you go like that, you don't anymore. But this one is just completely different.
Good.
I feel happy, even though it's costly. Nothing free in this life, but it's worth it. Definitely
worth every penny.
What about you, Bob?
Wonderful, because one of my hobbies and pastimes is singing in a choir.
Oh, really?
And of course, obviously, you're in the public, you're viewed by the public, you have an audience. And when you're singing, of course, you naturally open your mouth, and sometimes you have to open your mouth really wide. So consequently gave extra confidence when performing.
Just another question. So what can you do now that you couldn't do before your surgery?
Enjoy pork crackling. Enjoy a good steak.
It was
and
the
not
steak.
worry about it, yes.
So I think the main thing is definitely the eating.
Oh, yeah.
It took a little bit to get used to. Oh my gosh, can I actually eat
like
everything here?
You have to feel confident, you've got to do it gradually.
This is again just about eating, but have you discovered a new favourite food, or have you been able to revisit an old one?
No, it's just back to normal.
Yeah.
If it moves, I'll eat it. Just back to the old routines, which is wonderful.
I think it was an apple for me.
Apple.
I do like a Waldorf salad quite a lot, so I can eat the celery now and the little cubes of apple.
Get that
It was wondering where all the little things were going.
Chopped up. They do go in between
The seeds and things, because that is the only. It's not a negative with an implant, but when you use the super floss, that goes all the way under. Because I've got 3. A seed might get stuck, and which you might have done. Well, it would have got seriously stuck before because it would have been fully there. So it's just being mindful. But if you don't already use the super floss,
do you not use a machine?
I do.
Are they good?
Oh yes, very good. The water flossers are very good. Brilliant, absolutely brilliant.
And that just blasts away.
You just fill it with water, it pumps out.
Bit messy though.
Yeah, that's the thing.
I don't care.
Yeah.
I don't care.
Well, it was definitely the apple, because before you wouldn't dare bite because you didn't have to bite, or you'd worry were a bigger thing. But now it's
The trick about the water flosser is to use it in the shower.
Oh.
That's a
That
good
way,
tip.
that way you don't have to worry about it.
Next question for you guys. How would you describe the change in your confidence since having this surgery?
Well, I say that my muscles in my face is stronger because I keep on smiling all the time. So
Aching with smiling.
It's nicer just to be able to smile and to know that you're not going to look like some creature from Jurassic Park. And the confidence came from being able to, interact with other people and not think, oh my God, they're looking at my mouth. And especially my grandchildren. I want them to think that, their granddad is quite normal and quite reasonably good looking and doesn't have any nasty gaps. And he's not just a toothless old wonder, And that's became very important to me.
Just the confidence, not that you can speak and you're not kind of wanting to do that kind of thing. Well, I still haven't got any teeth right at the back because he said I didn't need 4 implants on each side. That was far too many. He said, so we've gone hopefully as far as you can't see in normal day-to-day.
They won't try and sell you something that they shouldn't, because I've got a gap here, but Dr. Dalgouti looked at it a few months ago and said, you really can't see that when you smile. Let's not do something for the sake of it.
Yeah, so they're only giving you what you need.
What I need.
They're not trying
Which
to charge
this
you
is
to
where,
fill them out.
Oh no,
Yeah.
I found that as well.
Yeah.
I found that as well.
Yeah.
I mean, my first visit when I saw the 3D thing.
Oh, yeah.
And it's amazing how,
is.
what's going to happen. So it's before you actually go to the surgery, you've got an idea what to expect.
You
And
see
that
it all,
gives
don't
me-
you? Yeah, the plan of,
Absolutely.
oh, wow,
I think,
yeah.
oh my God, technology.
Yeah.
But the scanning is just incredible.
How they do the different thing, or they,
It's a little bit frightening sometimes because you look at the inside of your mouth on the screen when the consultant shows it to you.
Yeah.
And it is a little bit like alien predator type situation. And you think, oh my God, is that inside of my mouth? But the end result comes out wonderfully well.
Technology's moved on so much, hasn't it, in dentistry,
Not only did it do the outline and shape of your tooth, but it also was able to look at your existing teeth and do the colour matching.
I was going to say that, yeah.
And in that respect, you were guaranteed to get something that blended in and didn't stand out and people said,
Oh, look at you.
like with the old-fashioned gold tooth or silver tooth, and people have diamonds in them or whatever, and you're immediately attracted to that.
Yeah. I was like going for a foundation shade. It was exactly that. They said, oh, are you a point this or whatever? Yeah, I was like, oh. I
It was so easy, it was seamless.
Yeah, so it all blended in.
It's a life-changing surgery, and sort of what made you want to do it? So what made you just think, I'm just gonna splash the cash and get this done?
In my case, my son was getting married in Belfast. Big wedding. And I thought, and again, I was tempted to leave it until, a few months' time. But I thought that is perfect timing for me. And it's good occasion, showing off a bit.
Gave you a reason to do it,
And
didn't
it is.
Yeah.
Why not?
Yeah.
Man was the same. It was a combination of 3 things. One was vanity on my own part, spousal pressure from my good lady wife, who I love dearly, and more importantly, the convenience of having it done and being able to have it done, and the difference between having a dentured implant and a proper implant. There was no way on God's earth I wanted to have dentures. I'm of a generation which grew up with family where grandmas and grandpas and fathers and mothers used to have dentures. It was the thing to have your
was the thing, wasn't it?
teeth taken out when you were 21.
Yeah.
That was your
Same with my
21st
family.
birthday, and then live with dentures.
Oh dear.
Thank you very much.
I can't think. I'm sorry, I'm showing my age now, but I can't think of anything worse. And the idea of having a denture in your mouth, and then being in a social situation, perhaps talking, and then the whole thing falls out. I can actually recount something because I used to do a little bit of theatre work, quite a bit of theatre work. And I remember on one occasion a gentleman being on stage, principal part, singing away, and he was on the back of the stage, and the dentures flew out and landed and slid right to the front of the stage.
Because they weren't in very securely then?
Well, but I just didn't want that. Didn't want that, no. And that's why I went down that route.
I think I did it because you don't realise how the as you're getting older, what the face was looking like. So.
Oh yes, your face sinks.
It
doesn't
sinks.
Mine's still
Yeah.
got here, and that's partly age, but also partly because I've got 2 teeth missing on each side.
Yeah.
Because I lost 4, you see, on each side at the back, and I've only got replacement of 2. I forgot what the question was. I was going to say something. And
It was just like, why did you do it? Why did you just take the plunge?
because I could. I mean, I was
Absolutely.
fortunate. I was fortunate. I could.
We are
It is.
fortunate. And also, one more thing actually is the aftercare. I mean, I was thinking of Turkey, God knows where.
yeah.
And I'm thinking, if anything goes wrong, what happens?
Here.
You're on a flight.
Yeah, flight, go back, because dentists won't help you.
No.
That's the reality.
Never do that,
Yeah.
no.
So that is another reason
It's
why.
local,
Yeah. I had that in the day. You actually do the operation, the taxi will take you straight to the airport. Bye-bye.
I've heard all sorts of horror stories. As I say, my friend who has got the ubiquitous turkey teeth, and they're fluorescent white,
Yeah, you can
titanium white,
Yeah.
and they're totally out of proportion. And that's the thing I like about what I've had done. It's seamless. It's invisible. Unless you tell people you've got implants.
They don't know, do
Nobody
they?
knows.
Nobody
Nobody
knows.
knows.
No. And like when you said with the aftercare, I remember when I just had 1 implant here and a few here. And there was this, I thought, what's that there? It was stitches in the end, but it was this grey thing. I kept thinking, why won't it go? And I remember ringing the practice, Dr. Delgo said, WhatsApp me a picture. So I remember getting my neighbour to take a picture, and he said within seconds, it's a stitch, it'll be gone in a day or 2. So it was just that, what was that? And, sent him a picture, and he kind of laughed when he rang and said, oh my God, something's happened, but it wasn't. So it was like, peace of mind on the doorstep.
It took a long time. The whole process took for me from having the teeth out to the implant in was nearly a year each time.
Same here. Mine was a year from start to finish. But you've got to
It's a
do
long
certain
time
bits.
because apparently the longer you leave the post to
Yes.
cover
Yeah.
over, the better chance you have of it being successful.
Indeed. Yeah.
And that was another reason why we went to that practice.
Because yes, you're doing it's like the old-fashioned thing of making your first expense your last one. You put up with it now and get on with it for the rest of your life.
You weigh it all up, don't you? Because we've all had years of moving our food around. Yeah.
So how did you all sort of find out about Yorkshire Dental Suite?
I knew Yorkshire Dental Suite by going through with Dr. Nigel. I didn't know about the actual practice itself. I went with the man, but I subsequently was talking to a friend of mine who's an ex-dentist, and he was my dentist originally, but subsequently retired. And he always said, and I told him what my problems were. I said who I was going to see. He said, fantastic. He said, if I was having my teeth done, the dentist, he said, I would go to him. And then I said, why do you ask? He said, thumbs up. No problems at all, the best.
Well, my husband told you was a dentist, and he had a friend who was a dentist, and they said the dentist's wife had been to see Dr. Dalgleish, and she'd had a lot of problems, not abscesses, but she'd had some very specific treatment, and they recommended that we actually go, not to the practice as such, but to Dr. to him, and that's where he was. So,
absolutely, yeah.
But it was the person, not the practice.
In my case, it's, initially social media. I was just looking, as I completely retired, I've got all the time in the world. And then I found out that actually my dentist knows Dr. Dalgleish. And I was amazed, and he said, he's the dentist you need to go for. He's the one. And as a result, I've been taken off from my old dentist.
I've been removed from mine. I've been removed because I haven't been enough. Yeah.
You guys are in trouble.
Where have you gone? But with me, like I say, with my friend, I met this girl quite a few years ago, and I was thinking things with my teeth, and I was eating out with her more, and I had started to do a bit of research. What can I do about these gaps? And then, like I say, it was the day when I was eating that piece of beef and thought, enough's enough. And she said, let me show you where my husband works. He's not been there long, but I can recommend. And that was the start of it. But yeah, it was when you start looking, it's like when you get the old yellow pages out and you go in alphabetical order. And so I'm glad I had a recommendation and I was in within a few weeks. And it took probably 6 months before the journey started because let's get this right. What do you
Well, I'm glad I got
need?
the recommendations.
Yeah.
I really
I think
am.
you need recommendations on something.
Yeah.
Oh,
It's
yes.
a lot of money and time. And
How did you find sort of the overall experience at Yorkshire Dental Suite? Did you find it comfortable, all of that?
Very welcome.
It was like going to a 5-star hotel.
It's actually, they put you at ease. That is really important.
they all got to know me. Oh, here she comes again, yeah.
I found everybody charming and efficient and pleasant. It's the way in which the staff were able to recognise you and relate to you and greet you in a personal way. And also, I don't know what it was like with your consultants, but certainly with mine, he always used to come down to the reception and meet me.
Yeah.
And we would shake hands and have a chat and have a natter. And he would come down
Bring you
personally
back.
and then take me to the surgery and then bring me back. And I just like that personal service.
And you got to know everybody else. Dr. Nigel would be like, and wave.
Oh, yeah.
And all from the front of house staff to then the different girls that would assist, boys, girls that would assist the different dentists.
And there was always a pleasant atmosphere. I got the impression that people liked working there. It wasn't a chore. It wasn't a case, oh God, I've got to go to work again. I'm dealing with this and this and this and this.
How did you find the recovery process? The floor.
No problems at all. In, done, out. That's it. End of.
Even all the different stages of...
Yeah.
I
It was
guess
seamless.
It was the eating initially, because I think I had one there and, we worked the different bits. So the only initial bit was the worry if you got anything near. So I don't know about you guys, but you had to change the diet. It was looking like scrambled egg and avocado. So it's the soft foods, because I was scared of...
In my case, was obviously liquid for, I think, 2 weeks. And as a result, I lost about 1 kilo, which was fantastic. Because I've been trying that for years.
Because there's no where the
Exercising.
stitches were and did anything,
So I was just back to normal almost instantly.
Good.
Same thing.
I'm sorry to brag about it, but it was damn good. I loved it.
I was back to going to the gym after 2 weeks. Really did.
Well, I had to take preventative antibiotics because of my other conditions.
Oh, exercise was never a problem for me. If ever I feel the need to
taken it up since.
No, if ever I feel the need to exercise, I just sit down until the feeling goes away.
All your family and friends probably knew that you were having this done. How did they sort of react when they kind of saw you afterwards? I know, like, sometimes it's towards the back, so they maybe wouldn't have noticed, but would still notice your face or anything about your personality changing. Sort of, what were their reactions when they saw you afterwards?
My wife was delighted she could have a photograph taken with me. We could do selfies. We could do
Looking
group
normal.
looking normal and not looking.
So she's not ashamed of going out.
Exactly. Well, exactly. Right.
You're not coming out today.
Exactly. Well,
After 40
I know we
years.
joke about it, but it's important, that when
'Cause
you
it
do
does, it affects.
like yourself with your smile and your wedding photographs. It's important when you have family occasions like that. You want to look your best.
Well, in my case, there was a gap. Obviously, the teeth were shrinking because it's the gum disease, and you can see the gap and all that gone. So a friend of mine were just looking at me very cute. I did not tell them.
No.
Yeah,
A few friends I did not.
Yeah.
And they just look and said, "Your teeth is fantastic.
Yeah.
What's happening?" I said, "Right, I tell you what, you got to Yorkshire Dental.
You too can
You
look
will
like
find
this.
out."
You can look like me.
Yeah.
What would you say to anyone who is thinking about potentially having implants, but they're kind of feeling a bit unsure, they don't know whether to go with dentures, implants, they're sort of looking at all the options. What would you say to them?
I tell them it is very, very costly, and obviously that's a consideration for some people.
But you say have a consultation, and then go in with some ideas, because I mean they check everything, don't they, about your health? Do you smoke? Do you drink? What's happening with your gums? And then they'll give you advice: can you or can't you? So I guess have a 45-minute consultation, pay whatever it costs, and talk about your options with an idea of what you think you want to achieve.
I've recommended the YDS.
They were on commission.
To several people. I wish I was, but work for me.
Work for me. Go and see, and
we
you can change your
can't
mind.
say Well, I'll do it again.
wouldn't do it again, but was worth it.
I hope I don't have to do it again.
If you were going for any other kind of surgery, unless it was an emergency surgery, if you were, you know,
have no
most people
choice.
would research a bit and ask around.
You do your due diligence.
Yes,
correct.
Yes.
I mean, obviously, if,
To me, it's a good choice.
Yeah.
Thank God.
Money well spent.
Yes, money well spent.
life-changing.
Yeah, money very well
well,
spent.
I'm still going, so
Yeah, I
it's
am.
getting some interest. on
January the 7th I'm in.
on his
Check out.
investments
Have you got,
anyway.
have you got a season ticket?
Yeah,
Well, no, I don't. I only go now for checkups.
I do.
But